One of the scariest things that has ever happened to me as a father is when my son fell and then the next day was not able to walk. We ended up finding out that he had a concussion, and this was so scary for us. Something that we see often in pediatric patients is kids hitting their heads. And as parents, it can be really hard to know, when do we take our children to the emergency department? Well, I'm not an emergency medicine physician, but I know an incredible one. So Dr. Beachjim, could you tell us, when should we take children to the hospital after they've hit their head?
Thank you, Dr. Martin. I work in the ER, and we want to see kids after head injuries if they have loss of consciousness, if they're having vomiting, if they have a severe headache, if they have altered mental status like acting confused, if they have a seizure following the injury, if they're not able to move their arms and legs, or if they're not able to feel them appropriately. Also, if they have bleeding that won't stop or a laceration. The way that they got hurt matters as well, so a more severe mechanism, the more likely they are to have an injury. So if they fell from something high, like 3 times their height or more, if they had a bad car accident, or if they were hit by a fast projectile. And also just trust your gut. If something doesn't feel right or they're not acting right to you, bring them in, let's check them out. Not everyone with a head injury needs a CAT scan of their head, and CAT scans only show broken bones and bleeding. It does not show a concussion. I hope your little guy feels better, Dr. Martin. That's a cool name, Dr. Martin. Stay safe out there, guys.